Happy Child Health Day, Dr. Ghandour.
Happy Child Health Day.
It's so great to have you here today. I know you're the director of the National Survey of Children's Health. Can you tell us a little bit more about the survey?
Sure. Well, first of all, thank you so much for having me, and please call me Reem. The National Survey of Children's Health is the largest national survey on kids' health in the country. We produce data every year, and we produce estimates at both the national and the state level, which is really important when you're thinking about policy and programs that are going to affect folks in your community.
Oh, great. And can you tell us about the new data set that's being released?
Sure. So every Child Health Day, we release a new year of data. So we're releasing the 2021 National Survey of Children's Health data this Child Health Day. And there's some really exciting new indicators in this data set. So first, I think importantly, we have new indicators related to COVID. So folks will be able to look at whether or not kids missed preventive visits, whether or not they received telehealth, or whether or not they had any childcare disruptions. We also have new data on young children's nutrition behaviors, and specifically whether or not preschoolers are eating their veggies and their fruits or having sugar-sweetened beverages. And then finally, we have a new adverse childhood experience indicator, which focuses on whether or not kids experience discrimination based on a disability or a health condition. So lots to get into in this new data set.
Oh, very interesting. And as you know, I work in the Division of Services for Children and Youth with Special Healthcare Needs, and we recently released the Blueprint for Change, which is a framework to help advance the system of services for these kids. And one of our key focus areas is around health equity. Can you tell me how I might use the data set to help support this work?
Sure. So looking at equity and really diving into kind of who might need a little extra support is something that we've always focused on in the national survey. So in addition to the health indicators that I talked about, we also collect a wide range of information on sociodemographics like race and ethnicity, poverty, health insurance status, things like that, as well as the presence and impact of special healthcare needs, and even geographic location. So there's lots of ways to look at the wealth of child health indicators for different subpopulations. And that can give us all a better sense of who might need a little bit more support, either from national or state level programs and policies, and who's doing really well. And maybe we can understand a little bit more about why.
Thank you so much. This is so helpful. And can you also tell us about what's new to come in the new year?
Sure. So because we are an annual survey, we're actually in the field right now with the 2022 National Survey of Children's Health. And there's some really exciting content in this current survey. So next October, so October 2023, we'll be releasing data on school readiness for children ages 3 to 5. We'll also have new data on housing instability, which is a key social determinant of health. And then finally, we'll have new data on disordered eating behaviors, which at least as far as we understand, it's going to be one of the first times we'll be able to look at that particular health risk behavior by both the state and the national level. So lots to come, and we're really excited to continue to innovate and grow the survey in those ways.
Thank you so much, Reem. This has been so helpful, and I can't wait to dive into this data set. And I hope our state and local health agencies will use this data as well as our partners.
Well, we do as well. Thank you again for the opportunity. And we're always available to help folks at any level getting into the data, using the data, or interpreting their findings.